Hello, today, we will talk to you about the basics of COVID-19, including the virus that causes this disease, some of the signs and symptoms of the disease, and how it's transmitted between people. We want to describe some ways on how to prevent the spread of the COVID-19. Now let's talk about the virus that causes COVID-19. So the virus that causes COVID-19 is a coronavirus. Coronaviruses are a large, diverse group of viruses, and you need powerful microscopes to be able to see them. Coronavirus means crown. And as you can see on this slide, the virus looks like it has a crown around it. That's how coronaviruses got their name. It is also known as severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The first cases were identified in people with pneumonia in Wuhan, China, in late December 2019. It probably started in animals, most probably from bats, but is now spreading between people. As this virus is new, we are learning more all the time, and what we know now may change. These are the countries with the highest amount of confirmed cases over time: United States, Spain, Italy and China, where this virus first originated. How a person gets COVID-19 infection. A person can contract COVID-19 if they come in contact with another person infected with the virus, someone infected coughs or sneezes directly to them, and they touch any surface with little droplets from infected people's cough or sneezes and then touch their eyes, nose or mouth. Signs and symptoms of coronavirus disease or COVID-19 may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is called the incubation period. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms, and some people may have no symptoms at all. Common signs and symptoms can include fever, cough, sore throat, fatigue. Other symptoms can include shortness of breath or difficulty breathing, loss of taste or smell, headache, muscle aches, diarrhea, and chest pain. Although most people with COVID-19 have mild to moderate symptoms, the disease can cause severe medical complications and lead to death in some people. Here is some emergency warning sign to be considered for immediate medical assistance. The signs include lips or face suddenly turning bluish, persistent pressure in the chest, confusion or inability to wake up, and difficulty or trouble when breathing. Your doctor will determine whether to conduct tests for COVID-19 based on your signs and symptoms, as well as whether you have had close contact with someone diagnosed with COVID-19 or traveled to or lived in any areas with ongoing community spread of COVID-19 in the past 14 days. Your doctor may also consider testing if you're at a higher risk of serious illness. To test for COVID-19, a healthcare provider uses a long swab to take a sample from the nose or throat, and the samples are then sent to a lab for testing. Another way is by a blood test. Currently, no medication is recommended to treat COVID-19. Mild symptoms can be treated with medicine to lower the fever or relieve pain. If symptoms are more severe, treatment in hospital is required. We could reduce our chances of being infected or spreading COVID-19 by taking some simple precautions such as maintain social distancing, wash your hands frequently, keep objects and surfaces clean, and don't touch eyes, nose or mouth. Maintain at least 2 meters, that is 6 feet distance between yourself and others, because when someone coughs, sneezes, or speaks they spray small liquid droplets from their nose or mouth which may contain viruses. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person has the disease. Additionally, stay out of crowded places and avoid mass gatherings. Moreover, keeping distance from older adults as they are the most vulnerable to the virus. Wash your hands frequently with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Last but not the least, clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, handles, desks, phones, and etc. Additionally, avoid touching your eyes, nose, mouth, and wear the mask while going out. This is our team who committed their time to prepare these slides to briefly educate the community regarding the current global pandemic. The team consists of 2 public health professionals, a physiotherapy student, and a medical student. Thank you. Please let us know if you have any questions regarding COVID-19 below in the comments section. Also, if you liked the video, then do like, share, and subscribe to this channel.